Today, we shine a special spotlight on our frontline workers, healthcare workers around the country who have given of themselves to save lives and to try and keep South Africa safe. But not only South Africa, we turn our attention now beyond our borders to Zimbabwe, where the overburdened health workers say that the daily fight against the coronavirus is taking an emotional as well as a psychological toll on them. The struggling economy as well as the dysfunctional health system have not made things any easier. Joining us now, our reporter in Zimbabwe, Xolisani Ncube. A very good afternoon to you, Xolisani. Tell us about the situation at the hospitals in Zimbabwe as far as staff in the healthcare sector are concerned. Are there enough staff?
Good afternoon, Tammy, and good afternoon to our viewers. Indeed, in Zimbabwe, like many hospitals, globally, because of the pandemic, they are in short staffed. The country is running low in terms of the number of nurses, the number of doctors that are required. The ratio is so low in terms of a doctor to patients. This is largely because of the country cannot afford to recruit more doctors. Only last week, government announced that it will be recruiting an extra 500 nurses to try and assist. But that still remains very low to accommodate the number of people who are in need of hospital admission at the moment, largely because of the second wave, which has hit the country so hard and so desperately do they need health workers to assist.
I mean, apart from just the physical hands to do the work, there's also the issue of beds. What is the situation like in hospitals there in Zimbabwe?
Well, in Harare, I would give you a very rough figure. When you talk of COVID-19 and the number of beds that are available for COVID-19, according to the senior doctors, they tell us that only 120 beds are available in Harare. And at some point this month, we recorded more than 200 people who were in ICU in Harare at a given time. That led to the number of beds in shortage. And we have witnessed the number of patients who have died outside hospitals because they couldn't be accommodated. We have seen patients who have been pushed to lie on the floor in hospitals because there are no beds, be it private as well as public. So all those are coming in and they're compounding on a situation whereby already we've got staff that is demoralized, staff that is getting little salary, as well as operating with little or no protection at all.
Tell us about the demonstrations that have transpired in Zimbabwe from healthcare workers thus far.
Well, we have 2 weeks ago we witnessed nurses down tools at Salim Gabe Hospital, that is formerly Harare Hospital, after one of theirs succumbed to COVID-19, and they allege that this was because of the staff or the management did not provide them with enough PPEs. And this is the person who was attending to the maternity ward, and she succumbed to COVID-19.
Tell us about the issue of vaccination, Xolisani. I mean, South Africa is getting ready to receive its first batch. What is the situation in Zim?
Like South Africa is to be getting and knows when the vaccine will be coming. In Zimbabwe at the moment, nobody knows as when the vaccine will be coming. The government says that they're still in talks with manufacturers of vaccine to establish the vaccine that they would want. Secondly, the quantity as well as the modalities of importing that vaccine. This morning, I spoke to the Minister of Health, the Deputy Minister of Health, John Mangwiro. He says that they are almost close to reaching a deal with Russia and China, but the issue is the cost involved. Zimbabwe would need around 60 million for the vaccine if it is to buy the cheapest vaccine that it wants to at least inoculate 60% or 70% of its population. That amount the country cannot afford. Already, the country is reeling from drought. The country's economy is already on its knees, and 60 million is something that the government can't afford at the moment.
And so, affordability being an issue, what are the alternatives perhaps that government has put forward as to how they hope to raise this money in order to get the vaccination?
Well, the government has proposed to Parliament that people would be able to buy the vaccine direct from pharmacies at a cost of $2 to $9, depending on the brand of the vaccine. So those are the issues that is before Parliament that is being discussed. There are some who are saying this can't be because already the people are impoverished. They can't afford even to have a meal a day. Remember, in Zimbabwe, the population, many or so live below $1 a day. That's US dollar a day. And now they're being told to fork out $2 to $9 for a single dose. That they say it's impossible. It's like sending people to die. You're punishing people to die, and in the end we could see increase in mortality and morbidity, which is a sad situation, I'll tell you.
As far as the healthcare workers are concerned, what has been the fatality rate there, and are there provisions to at least provide them, the frontline workers, with the vaccine?
Well, from what we were told this morning by the Deputy Minister of Health, he says that when the government finally gets the vaccine, the frontline health workers will be the first to be prioritized when the inoculation starts. But the question is when. So at the moment, the health workers are exposed. We hear and we understand from the senior doctors that at least on any given day, 2 health workers get infected by coronavirus. And in the process, a number of them are either in isolation or they're in hospital, nursing the COVID-19. And in turn, this reduces the number of nurses available or number of health workers available to attend to the public. Something which is a worrisome situation because very soon the country could have hospitals with no staff. So that is a very, it's a challenge which the country or the government has to deal with as a matter of urgency.
Well, thank you so much, Xolisani, for that update. That's Xolisani Ncube, our Zimbabwean correspondent, giving us an update on the situation in Zimbabwe as far as health workers are concerned, as well as the vaccination process and the challenges that the Zimbabwe government is currently facing.